This is a 54-year-old female with sudden chest pain, ST elevation, elevated troponin. 3 days later, now the story went to 3 days later. So this is an important thing to note here in this question. Okay, so 3 days later, she becomes hypotensive. Okay, uh, and a new holosystolic murmur, raised JVP. So there is a lot of information given in this question. If you're preparing for your comp, they generally cut down on this level of information. Step one, they do like to give you all of this information. A new murmur is harsh, best heard at left sternal border, associated with a palpable thrill. What is the most likely cause of her acute deterioration? So I see some of you have answered this question. Okay, so ST elevation, chest pain, ST elevation, is this MI? I can say, of course, yes. But then the question went to 3 days later. So 3 days later, hypotensive and murmur raised JVP. So a new heart sound has shown up 3 days later. Okay, so it's a holosystolic murmur, raised JVP, and hypotensive. Okay, so one thing I love, and you should always focus on it, raised JVP tells you so many things. Okay, of course, not specify anything, but tells you something is wrong with the right side of the heart or the entire heart, but involving right side of the heart, right? That is what JVP is. You know what JVP is, right? We just want to look at the right heart, so easy ways to look at the JVP because it's a direct connection, right? Okay, so raised JVP told me there is something wrong globally with the heart, or of course, could be with the right heart. Okay, now new murmur is harsh. Okay, and it's a holosystolic murmur. So what has happened is, why do you think this new sound has originated? 3 days, 4 days is a very good time for some ruptures to happen in the heart muscle after MI. So is MI necrosis? Is the cardiac muscle dead? A lot of cells are dead. Yes. Okay. So what happens to dead cells? They just deteriorate, right? Macrophages removed those dead cells. It takes a while for fibrosis to happen and repair to happen. That happens over months, but 2 to 3, 4, 5 days, it's like very likely a lot of ruptures can happen in the heart in this patient. So this is around 3 days, so 3 to 5 days, like I said, uh, is a very important time for you to remember for septal rupture. Okay, so septal rupture has happened, and that has led to this, the VST sort of murmur. Okay, so this is interventricular septal rupture. Okay, so the murmurs are different in different ruptures. Okay, so if it would have been a papillary muscle rupture, it would have generated an MR regurge, right? It started to regurge, but in this case, what tells me the blood is going to the right side of the heart? Raised JVP, right? Raised JVP. I mean, it's like telling you that interventricular septal rupture has occurred. So there is a space between the two ventricles, left and the right ventricle. And of course, the pressure on the left ventricle is higher always. So it's more blood going into the right ventricle. That is what is causing this murmur and raised JVP. Okay, so this is a new VST murmur because of this acute heart failure, and that is hypertension. Okay, sounds good, interesting. So I have all the options written down here for you, explanations for everything. So if you want to read, okay,